So now we're gonna go over the LTV. The LTV is gonna come in this yellow case, which is gonna have everything in it. You're gonna have your 50 psi O2 hose tubing, the ventilator, a battery pack, and the AC DC adapter for the power. The ventilator itself has a 45-minute internal battery, and the battery pack should last up to 2 hours. Okay, to connect it, your 50 psi connection is going to go on the side right here. Okay. And then this will connect to the wall. Your battery pack, if they're, well, most of these will have a battery pack, some of them do not come with it. So if it doesn't come with it, you'll simply just connect your power to the connector here. It only fits on one way. To release it, just press on the latch and pull out. So connect, pull out. If it does have a battery pack, you're just going to add the battery pack in between. So it has the same connections. So click in on one side, click in on the other side. So now when these two are connected, it's charging both the battery pack and the ventilator itself. So this is the circuit that's going to come with the LTV. There's a couple pressure lines and a flow sensor. And they all connect. They're all color coded on the side. It's kind of hard to see. So you got, they only fit one way. They each have their own separate connection. Can you see that? Let's put it down. So it's simply going to be clear lined for the pressure line, yellow to yellow, and then white to white. So just screw on. Okay. Alright, so once you have those connected, this little adapter will come inside of the bag. Get it out. Some of them will actually have it still attached to the unit, but this is just a regular 15mm adapter. It fits into that slot. On top of that, you'll put your bacterial filter and then connect your circuit to the bacterial filter. Oops. Okay. So that's how you would connect the vent. Okay, so to turn it on, to start the vent check, you're going to hit select and on, and hold it to turn it on. Okay, silence, and then it'll enter the vent check. So you're going to hit select. The alarms, this is just going to make sure that the alarms are audible. So select. Just keep hitting select to cycle through the different tests. The display is just going to light up the entire screen to make sure all of the lights work. Controls, so the control is going to check on this control knob on the bottom. This is how you're going to change all your settings. So you're going to select. The leak, so the leak test is the actual circuit leak. So once the circuit is connected, you're going to select the leak test. You're going to block at the Y, the proximal end, and let this, and that's it. Alright, so once the ventilator is on, you're going to hit select same patient. So same patient or new patient. You're using the dial down here, so let's say new patient. You're going to select adult, pediatric, or infant, so we'll select adult. This alarm, because I'm not plugged to oxygen. Your pressures on the bottom, or your modes are located on the bottom. You either have volume control or pressure control. To select the mode, you just hit select, wait till it's blinking, and then hit select again to change the mode. Same thing on all these other, so your assist controller, SIMB, CPAP are located here. If you want to change that, simply select, wait till it's blinking, and select again. Go back to the volume control, and it's just changing the settings on here. The settings that are lit up are your current settings. The ones that are kind of faded off to the background, those are inactive. So for instance, pressure control is inactive because it's faded to the back. Right now we're on volume control, so you're just gonna press, you can change your rate, your tidal volume, change your rate, your tidal volume by simply selecting the button underneath. So you'll notice that everything else gets faded out, so for right now, your rate is the only thing that's selected. You can use the dial to change it and then lock it in. Same thing with the tidal volume, dial, change it, and lock it in. Your peep is located down here. On the LTV, you can go up to 20 of peep. And your alarms are located in the red box here, so you can set your alarms here. As far as troubleshooting, the main thing is make sure your battery is charged. Your charge status and battery level are located in this box. Currently it's charging, so it's going to show up as orange. If your battery is low or it's about to die, so when the internal battery gets low, you actually get this vent in-op light that'll show up, and then it's telling you that you have 10 minutes until the vent actually shuts down. On the battery pack itself, each of these batteries, there's 2 separate batteries. You can test each one to make sure you have power in each by pressing the test button. So those will light up and tell you how much power you have in those. And then the internal battery of the ventilator itself lasts about 45 minutes without the battery pack. And that's it.